My name is Dr. Gregory Buford. I'm a board-certified plastic surgeon, founder of Beauty by Buford, Core Aesthetics Consulting, as well as the Core Aesthetics Training Institute, and I practice currently in Denver, Colorado. I've been with EON for several years. As a plastic surgeon, I do a lot of breast procedures, I do a lot of body procedures, but not everyone wants to go right to the OR. You know, a lot of people are saying, well, I'm in Denver, Colorado. Everybody's in great shape, but they all have these tiny little pockets of resistant fat. They say, you know, no matter how much I work out, I can't get rid of this little tummy in the front. I can't get rid of the love handles, what have you. This is a great way to start out. So I would say for anyone that has any type of body contouring practice, this is really an essential. After COVID, once we were reopened, my body contouring practice exploded, and that's really the trend that we saw across the country. But what's very, very interesting though is that trend has actually continued now, and we're 3-4 years out, which is crazy, and it's still growing. It really enables my patients to take what they have right now and take that result to the next level. So that's why we use EON, and I'd highly recommend it, and obviously I'm putting my name behind it. I was very skeptical. Again, I say that, I was very skeptical. When I first signed on, show me the money. I mean, I can see the studies and I can look at all these things and I can say, you know what, okay, maybe this works, maybe it doesn't. So what I do is I generally go in and get the treatment myself. Okay, I get the treatment myself because I want to see, one, am I seeing any results? Two, was it something that I can put my patient through? So in other words, when I'm lying there and I'm very comfortable and I'm thinking, you know what, this is something that I can easily educate a patient on. I don't want to say sell a patient on. You don't need to sell them, you just educate them. And if they're smart enough to realize the advantage, they'll run with it. So I think for any facial plastic surgery practice, or any practice for that matter, body contouring is an area that is a huge growth potential. We've seen that after COVID, and I don't see it going anywhere else. The fact that the before and afters are good, the fact that the before and afters are solid. Our first patient, I'll give you a good example. She lost 4 inches on her first treatment. One treatment. We don't change anything. We don't have them go on diuretics. We don't have them change their diet. You know, we do tell them, hey, you're spending money on this, so, you know, don't go to McDonald's right after the treatment. That's probably doesn't make a lot of sense. But we don't do anything artificial. The device uses an Nd:YAG laser. Okay, it creates heat that penetrates through the skin without injuring the skin. But to protect the skin, there's also jet impingement cooling. So what's happening essentially is you've got the laser coming through, but then you've got the cool air that's actually keeping the skin at a very normal temperature. Why is that important? Well, no, you know, we all want to lose fat, but we don't want to have burns, and we don't want to sit there feeling like a roasted turkey, you know, during the treatment. So it keeps it very comfortable. What the device does as well too is it has a number of sensors that identify the curve of the body, also too how far away the sensor is, or the device, the head is, away from the actual treatment site. Also the temperature as well too, and it creates a very significant temperature differential in the skin, or under the skin, I should say, in the fatty layer, where it warms up to around mid-50 degrees, I think it's 51 degrees, and then on the surface it's about 38 degrees. So it's the highest industry standard in terms of the differential, which is really huge, and that's what's necessary to actually melt the fats. You want to be ahead of the curve, and I mean, robotic fat melting, I'd say that's pretty far ahead of the curve. That's not, you know, that's not the standard, you know, at all. It really is a brand differentiator. And in that, you can actually change your brand, strengthen your brand, and create a much more competitive presence within your local environment.